Welcome everyone to Baycare Presents. I want to thank you for being here today. You're in for a treat because Dr. Szell is a phenomenal speaker, and I've been very blessed to have her speak a number of times for me at different events. And this is such an important topic that people don't always want to talk about. So I think it's great that she is going to share this great information with us, and hopefully you walk away with some better tools on taking care of yourself. So Dr. Szell, I'm going to turn it over to you.
Thank you. Okay, so yeah, we're just gonna kind of touch lightly on topics about the urinary tract. I'm sharing I would describe it as more low level information. I'm going for more of the basic stuff that I would talk with people about. And I think probably some of the questions we have will be a little bit more specific, which we can answer. But I kind of just wanted to start off with how do we make our genitourinary systems better for life. So kind of what everybody should know. So I'm going to try to advance myself if it's going to let me. Okay. So we kind of want to talk about first and foremost, what organs are part of this system, because it's obviously near and dear to my heart and very important, especially because it's my profession, but we really need to focus on what these organs are. So the genitourinary system itself consists of your kidneys, and we'll get into a little bit more information on all of this later. Your ureters, which are simply the tubes or the conduits from your kidneys to your bladder itself, and then the urethra, which is that muscular contractile tube that you urinate out of. So those are the organs that comprise the genitourinary system that we kind of need to focus on. Okay, sorry, trying to advance. So I get this question, or not really this question, but I have this statement come up pretty much at least 10 times a day when I'm in the office, is I have a patient come in and I say, I need a urine sample. And they say, well, I just drank a whole bottle of water, so just give me 5 minutes. And I want everyone to kind of be able to visualize this. You're sitting there and you're like, okay, I just drank here's my entire huge thing of water, and I need to give a urine sample. So I'll give myself 5-10 minutes. Well, the answer is that it doesn't happen that quickly. And I commonly get this, and patients will be in the office and they'll say, okay, well, I just drank 2 bottles of water. Why can't I pee? Well, it's not like you drink water and it immediately gets made into urine. There's some steps on the way. It takes a little bit of time. So I want everyone to know. Oh, sorry, I didn't give you. Okay, I went on. Sorry. I didn't actually tell you, but it takes a good 2 hours. Sorry, I thought I put the answer in there. So the answer is, in a normally hydrated person, someone who's not dehydrated, someone who's not overhydrated, in someone who's sitting there during the day, it takes about 2 hours for the liquid you drink or the food you eat, the liquid within that, to actually become urine. So what is the function of our kidneys and bladder? Because we know that we have this system and, it's kind of self-explanatory. Well, obviously it makes urine, but we're going to kind of go just a little bit further than that. So the kidney's main function is to filter the blood. Yes, it makes urine, but the biggest part here is filtering the blood, getting toxins and waste products out of our blood that we don't need anymore. And it does so in a very convoluted manner. And not only do I know that it's convoluted, but if you look at these tubules themselves, a lot of them are convoluted. And so essentially what we're breaking this down to is blood with waste comes into the kidney through the artery or arteriole, goes all throughout the kidney. This is the nephron. The nephron is the important unit of the kidney cell itself. That's the working horse. That is the workhorse, the horsepower of the kidney. The nephron does all these things, and you end up with blood without waste, and that goes back to the body. And as that goes back to the body, urine, of course, is made as that byproduct and comes out into our urine, into our bladder. And if you think about it, if we're looking at rough kidney anatomy, you have artery in, you have vein out, and then you have urine here that's traveling down what is called the ureter or tube or conduit between the kidney and the bladder itself. So what are the functions of the kidney? So not just to make urine. Yes, it is to make urine, create urine, therefore cleaning the body of toxic substances and waste products that we don't need. The kidney really helps with regulating blood pressure. Big time. That is a big, big function of the kidney. It's also going to maintain homeostasis of certain elements and minerals in the bloodstream: calcium, magnesium, sodium, potassium. If you've ever seen a patient who's in renal failure or dialysis, or somebody whose kidneys don't work very well, we're always worrying about potassium, because that's one of those elements that isn't going to be regulated as well by our body, because our kidneys are certainly not working, and it's an important one. The kidney also produces red blood cells, which we need to circulate through our system. It regulates vitamin D production, as well as calcium, which is very important for the growth of bones. And it also regulates our sodium water balance. We want a balance of sodium and water in our body, because if we have too little or too much of one or the other, bad things can happen. So get this question a lot: what foods are really good for my kidneys? Well, the number one thing that we love to talk about is water, because water is going to help your kidneys. Water is the thing that your body is going to love the most. It's going to be the easiest, because it doesn't have to kind of move too much out of it in order to produce urine. And water really helps the kidneys go as well. So we really want water in our lives as a drink of choice. So a lot of these foods, and we're going to talk a little bit further about proteins and stuff, but a lot of these foods are very rich in things like certain elements and minerals, but are also very balanced. So anything that's really going to help balance homeostasis earlier on to the kidney means it's going to have to work not as hard later on, if you want to think of it that way. So a lot of these things are balanced in a lot of different nutrients, and that really is going to help the kidney more successfully make urine over time. I want to draw your attention to a lot of the proteins that we're looking at here. We're talking about eggs, we're talking about yogurt, we're talking about salmon, we're talking about beans, quinoa. All of these are great sources of protein, and a lot of these sources of protein are not red meats. And so I just want to bring that to your attention as we move forward. One more thing I want to mention here, spinach, because I get this question a lot about spinach and kidney stones and stones in your kidneys, just as an aside. So back in the old days, we used to tell people, don't eat spinach because spinach has a lot of oxalates, and oxalates cause kidney stones. Well, since then, we've really taken a good hard look at this, and we know that, yes, there are a lot of oxalates in spinach, but in order to really get too many oxalates from spinach, you have to be eating about 5 to 6 pounds of spinach a day. So on the planet right now, I am not going to tell any of you that you're eating too much spinach, because chances are you're probably not, to affect your kidneys and therefore your stones as well. Just a little aside there. So, let's look at high protein diets, because it seems like nowadays all we talk about is let's decrease our carbohydrates, let's increase our protein. Protein's great for us. We need more protein. We're on Team Ozempic. We're not eating as much. We really need to get our protein in. So how does protein affect the kidneys, and how do high protein diets affect the kidneys? So it's always been thought or postulated that more protein can actually cause the kidneys to work harder, or force the kidneys to work harder. And when the kidneys are forced to work harder over time, they wear out. So what we've actually seen is that if you break down the type of protein, if we look at plant protein versus animal protein, it's much more likely that more of your animal proteins are going to increase your risk of kidney disease versus your plant-based proteins, specifically the red meat-based animal proteins. Okay, and this is very high yield here, but basically what this is showing is that we are forcing the kidneys to work harder if we have especially more of that red meat protein. And when the kidneys have to work harder, they wear out quicker. And then we end up over time with what's called, or we move into what's called chronic kidney disease, which we're going to kind of get into there. And when we say glomerular hyperfiltration, that is that nephron unit of the kidney working overtime very quickly to kind of push these bigger particles through to make them into smaller particles to make all of this into urine. Okay, so I get this question a whole lot. How much water should I drink on a regular basis? And that old adage, 8 times 8 equals 64, 8 cups, a cup being 8 ounces, is pretty much true. But I wanted to put this into perspective because we say 8 cups, but what we really also mean is about 2,000 milliliters, right? So if we want to look at European measurements, it's about 8 cups or 2,000 milliliters. And that is for people who are not sitting outside sweating. That is for people who are not exercising heavily and, getting insensate losses. That is not for people who are necessarily sitting in Alaska in an igloo, shivering constantly. So this is for somebody who is of normal body size and habitus, who's not sweating too much, who's not shivering too much, who's pretty normothermic, meaning their body temperature is pretty okay for the majority of the day. This number is going to go way up, especially in Florida, especially in the summertime for a lot of our patients. If they're working outside, they're sweating, things like that. Okay, so remember how I said about 2 hours from drinking your liquid to making urine. This is just kind of a little schematic of how that happens because different parts of the body are going to use water and liquids and foods and things like that for different things. But again, drinking it's going to go to all these different places. But for it to physically be made into urine, it's about 2 hours in a normally hydrated human being. Okay. So we talked about water consumption. We talked about how much you should be having. I'm going to tell you 8 by 8 is 64. Always remember that. But have we ever really looked at what is the benefit in being at the higher end of that? What is the benefit in making sure we get our 64 ounces or our 2,000 milliliters in? And it actually has because, as a urologist, I'm constantly telling people, please drink more water, please flavor it with lemon or lime juice. You at least need to be getting 64 ounces in a day just simply to help prevent your stone disease. Well, we've actually found in some of these meta-analyses that not only does it help to reduce the amount of stones, it can help reduce the amount of recurrent urinary tract infections, but it can also help a little bit with weight loss, which again, everyone being on Team Ozempic nowadays and eating their protein. And the way it helps with weight loss is the more water you drink on a regular basis throughout the day, the more satiated you feel and the less you feel the need to overeat at meals. So this was just breaking down the meta-analysis, and you'll see right here, a small number of studies suggested benefits of water intake on weight loss and kidney stones. And certain studies raised the possibility of benefits for patients with migraines, recurrent UTIs, diabetes, and of course, hypotension, which would increase our bodily fluids. And let me tell you, it's not expensive to drink water, right? So there you go. Okay, so let's talk a little bit about chronic kidney disease because this is something that we see as urologists, as nephrologists pretty often too. So this is a nice little slide from Cleveland Clinic that is going to break this down very simply. You can get dry skin, you can be tired. I have to tell you the bubbly or foamy pee, it does not happen as often as people think it does. You can get the big thing that I see a lot of times with chronic kidney disease is really the swelling issue. A lot of patients come in and say, I don't have anything wrong. I have normal blood pressure, but all of a sudden my legs and my feet are swelling. I don't know what's going on. And it's kind of a good way to keep this in the back of your mind. Trouble sleeping because your hormones aren't as regulated, loss of appetite, muscle cramps that comes from changes in those vitamins and minerals that the kidneys usually regulate, and then actually needing to pee more often. which is very interesting because you would think that over time, and over time you will probably urinate less often or you'll make less urine. But again, your kidneys are having trouble kind of keeping up with things because they're slightly diseased when it comes to chronic kidney disease. So I actually see this a lot in patients where they'll come in and they'll say, I needed to see you emergently because I just looked at my last note from my primary care doctor and it says I have chronic kidney disease. And I had no idea and nobody told me and I don't understand what that means. So please help me. Valid point. Chronic kidney disease is measured both by what we call the GFR or the glomerular filtration rate. And again, that is how well or not well your kidney is being pushed to work. So if on average, your glomerular filtration rate is high or good, your kidneys are able to perform well without issues. If on average, this gets very low, then we're saying, okay, we've bypassed the point of no return here, only if we're here. And now the issue is our kidneys are not working nearly as well as they should be. Now, a lot of people, if we actually measure their GFR, and this is through lab work, blood work, probably live around here. Well, that's already considered stage 1 chronic kidney disease. Why is that? Well, the idea is that the kidney is a very special organ and it's not going to work as well as it did at the age of 5 as it will at 95, no matter what you do. Even if you have great blood pressure, no diabetes, nothing affecting your kidneys at all, at some point in time, they're going to get a little tired and wear out some. That is part of natural aging. But we as humans want to keep that from happening. Most people, when they're diagnosed with chronic kidney disease, we never look at stage 1 and 2. It's not on there, but they kind of sit here at stage 3A. Stage 3A is when you start to notice changes in your creatinine, which is part of your basic metabolic panel in your blood work, early on that may indicate chronic kidney disease. Now, the interesting thing here is that at stage 3A, I see a lot of patients here for the first time ever that come in and are alarmed or scared or have no idea. But what I will tell you is that this stage doesn't mean a whole lot long term. There are people who will make it to stage 3A at the age of 50 or 60 or 70 and live here for the rest of their lives. There is no guarantee that they're going to leave this stage and go any further. So then I get the question, well, can I backtrack? Can I make things a little bit better? The answer is yes. Sometimes there's an inciting agent that makes our kidneys not work for a short period of time, and then we can end up back here. But most people, once you hit 3A, are going to be there. Now, again, if we make sure our diabetes is in check, make sure our blood pressure is working great, make sure we exercise, we take in proper fluids, we have a good diet, we can maintain stage 3A for the rest of our lives. And it's okay to be here in that case. Sorry, I just want to go back. This is where we're talking about dialysis because I get that question a lot too. Okay, so we're going to shift gears a little bit. We talked about the kidneys. The ureters are the tubes or the highways from the kidney to the bladder. Now we're going to talk about the function of the bladder. So the function of the bladder is basically urine. It holds urine, accommodates, it evacuates or it pushes urine out, regulates the evacuation of urine, and it does control the flow somewhat because it's a muscular organ. What does the bladder not do? The bladder does not help with urination diuresis, okay? The bladder does not control the amount of urine that our body produces. And I'm going to say this once or twice over. The bladder does not control the amount of urine that our body produces. I think there's a very big misconception from patients, very understandable, but big misconception that we will take a diuretic pill like our Lasix or our hydrochlorothiazide, and the bladder will be working overtime on that urine. That's not really how it goes. The bladder simply accommodates, holds, and evacuates urine. the kidneys are the ones that are affected by diuretics, by diuresis, which is the process of taking the waste products and filtering them to make urine. So the bladder itself is not going to help with the swelling in your ankles. But the Lasix that you take that will decrease the swelling in your ankles, push that fluid more through your kidneys, so the kidneys have to work harder. That's how that works. So again, like we talked about, kind of hitting home here, the bladder is a very muscular organ. It's made of smooth muscle, and that smooth muscle stretches like a balloon to accommodate urine, and it contracts in order to evacuate urine. Those are the big functions of the bladder itself. The internal sphincter, which is usually smooth muscle, helps to trap urine in here. And the external sphincter, which is skeletal muscle, which is what we're trying to control when we work on our Kegels, is what helps some of the outflow of urine through the urethra as well. Okay, big question here. Why does alcohol make us pee more? I think everyone's experienced this at some point in time. So alcohol inhibits a hormone protein called antidiuretic hormone. So antidiuretic hormone is exactly what we think of it. Antidiuretic means I'm not going to make as much urine. So if we inhibit that, we're going to make more urine. So if we inhibit the ADH, we're going to make more urine. So the kidney is going to stop reabsorbing as much water, and it's going to increase the production of water out into the urine, making more urine. Thereby stimulating the kidneys to produce more urine. And not only does it increase the amount of urine that's going to go into the bladder, but it can also serve as an irritant to the bladder itself, which will increase that need or that urge to urinate. So alcohol essentially is going to act like taking your Lasix or your hydrochlorothiazide or your diuretic pill and contribute to more frequent urination. Another substance that we can take in, or we do take in quite regularly, is caffeine. Caffeine is also going to inhibit antidiuretic hormone. Therefore, caffeine and alcohol, we're going to make more urine and urinate more because we have more urine we're accommodating to try to evacuate. Caffeine as well is also postulated to serve as an irritant to the bladder itself, to the bladder tissue itself. More fluid, more urine, more irritation, more urination. Just to kind of touch on that a little bit more, there are a couple substances that I find as a urologist. Caffeine and alcohol are the two big ones that are natural diuretics. I get the question a lot, what about spicy foods? What about acidic foods? What about citrus? So those will not necessarily increase your diuresis. They're not going to increase the amount of urine, but they may serve as a partial bladder irritant. And there are lots of people who will say, I have my tomato sauce, I have my citrus, I have my lemonade, and my bladder gets really irritated and I just have to urinate more. So that's not unheard of by any means. But let's talk a little bit about urinary tract infections because I get these questions a lot, and we talked about chronic kidney disease, so kind of bad things that can happen with the bladder. Urinary tract infections, much more common in patients over the age of 50, 55. We use the term UTIs, some people use the term UTIs, but they can be confined to the urethra alone, in which case they're called urethritis, the bladder, cystitis or a bladder infection, or you can actually get infections that ascend into the kidney, which is called pyelonephritis. You're usually feverish, sick, in the hospital, not a good situation. The most common type of UTI is cystitis or a bladder infection, and the most common bacterial pathogens here are E. coli, Klebsiella, beta strep, staph saprophyticus, not the staph everyone else worries about, Proteus and Pseudomonas, and very occasionally we'll see viruses. That's rare in older patients. UTIs or bladder infections are much more common in women than men. Quite simply, women have a much shorter urethra than a man does. So they are more prone, unfortunately, to being able to have recurrent urinary tract infections as a gender. Urinary tract infections can be recurrent, they keep recurring, or they can be resistant. I took an antibiotic, it didn't help, I needed to use a different one instead. If they become complicated, they start to ascend into the kidney, or if we don't treat them for a long time, they can actually get into the bloodstream and cause what's called sepsis or urosepsis, which is an entire body infection that can be not great. And usually these patients are very sick, they're in the hospital, not great situations. Urinary tract infections account for about 10 million visits every year to outpatient urgent care as well as primary care clinics. And they're not fun. So the guidelines, which were just updated this year from the American Urologic Association, I am a urologist, were amended as of this year. We've been looking at them for years and years, which is a good thing. You want to keep always reviewing these moving forward. So if we're going to work on prevention of infections, what do? When women, this is the big one, women, and sorry, this is mostly in women, but it goes for men as well, have a water intake below 50 ounces. Remember, we said 64. If you're taking in below 50 on a regular basis, we're going to tell you to drink more water. There are plenty of studies that show that the more water you drink, the more you can stave off urinary tract infections. It's not a myth, it is a real thing. Most recently, what's come into light, which is amazing because these are over-the-counter supplements, so not regulated by the FDA, but also not regulated by drug companies, is that we can offer cranberry supplements, not cranberry juice, cranberry supplements, as well as another over-the-counter supplement called D-mannose on a regular daily basis to help prevent recurrent UTIs or difficult UTIs, especially in women. Both of these are over the counter. You can head over to your local pharmacy. You can get them there. You can ask them what their favorite brand is. You can get Azo Cranberry. You can get Eucora, which has D-mannose and cranberry in it. They work great, but there is no benefit to using both at the same time, just so everyone's aware. And if that doesn't work, then we, sometimes talk about our recommended prescription for recurrent UTIs, which can be methenamine or estrogen cream. Okay, so this is kind of how D-mannose works. Once it gets into the urine, it sort of blocks the little, and I have a picture of here, but there's a little sort of, think about it like a little foot or a little appendage on the E. coli, and it uses that to kind of tow into the cell inside the bladder to really get into that lining of the bladder to cause a bad infection. Which is what cranberry does. So cranberry contains these substances that inhibit specifically that little toe, that P. pili in the E. coli bacteria from getting into the wall of the bladder. Here it is. You can see the P. pili right here. And that's what kind of gets into the lining and tries to not only glom on and adhere, but then get into the cell to cause issues. It also does acidify the urine a bit, which helps to prevent bacteria from being as active in the urine. So, what did we learn today? In summary, please drink your 8 glasses of water a day. Thank you, at a minimum. If you want to follow a high protein diet, please consider plant sources over protein over animal sources, specifically to help improve kidney health. I'm not saying don't ever have your steak, not saying that at all, just saying that if we're trying to increase our protein, it's always good to have less red meat and more plant sources based on our high protein. Alcohol and caffeine will make the kidneys and the bladder work overtime. You're just forcing them to work harder. You will run to the bathroom even more, probably not as fun for you. Plenty of water not only helps prevent kidney stone formation, but it helps prevent recurrent UTIs, and flavoring it with lemon or lime juice helps with prevention for kidney stones the most. Keeping your blood pressure and your diabetes in check long term will help prevent chronic kidney disease. We talked about the over-the-counter cranberry and D-mannose helping to prevent recurrent UTIs. And don't forget that the kidneys themselves accept 25%, 1/4 of the blood output from your body every single minute. It just means that our GU system is important and deserves extra special care. And it's easy to care for. Just drink your water. Thank you. Okay.
Well, that was
and I
incredible.
welcome questions.
You're getting all sorts of applause because you did put so much great information in there. We're going to ask people to put their questions into the chat. We do have one. Someone was asking about how many times is it normal to urinate during the day for the average person?
So if you're average person and you are average hydrated, if you're drinking your 64 ounces a day, 6 to 8 times, anywhere from 6 to 10 is fine. Average is 8, and 1 to 2 times overnight as well.
And I know, like, in the field that I'm in, sometimes when people start to drink that more water, they feel like they're running to the bathroom more often. Is it true that the body will regulate to that eventually if you stay consistent?
The body will regulate some, and depending on your age and the quality of your pelvic floor, you may have to work on regulating it yourself too. And that's saying, okay, oh my goodness, I have this urge. Let me just sit down, take a deep breath, give myself 30 seconds, and then I'll go. Because the more that we say, oh, I'm just going to do what my bladder tells me to do, the more that we're going to be a slave to it. So we kind of have to accommodate ourselves as well.
That's a great tip. Is there any damage for holding it too long? Like you have to go to the bathroom and you keep holding it for a long time?
Chronically long-term, yes. So the bladder is made of smooth muscle. So smooth muscle, again, in this case, has 2 functions. It expands to accommodate and it contracts to evacuate. So the more that we cause it to work harder, that smooth muscle doesn't necessarily, it doesn't work like skeletal muscle. We can't go to the gym and lift weights and increase our skeletal muscle. That works perfectly. It does not work that way for smooth muscle. So the more that we force it to work harder, it will, but instead of forming more smooth muscle, it starts to form scar tissue over time. And when that happens, it stops its main purpose, which is accommodating. So then we're kind of doing damage, if that makes sense. And that, I don't mean that like, short term, like, oh my gosh, I'm holding it for 10 seconds. I mean like chronically over time.
So don't try and hold for a long time. I know we work with some of
Yes.
the nurses in the hospital system. They don't drink water because they're afraid to go to the bathroom because they don't want to leave the floor, or they'll hold it so long. So it's trying
Right.
to find that balance that's good for you.
Mhm.
Is there too much water to drink, or can I try and down too much at any one time?
Yeah, so it's obviously, not obviously, but it is better to kind of drink small amounts throughout the day. You're not really doing yourself a favor if you wake up and say, okay, I'm going to drink 4 bottles and then I'm not going to drink anything for 6 hours. So you're not doing your body any favors. And you can overhydrate yourself. There is such a thing, obviously, as water poisoning, we call it, because our body has the ability to, regulate and circulate, but it needs time. So, yeah, you don't really want to, I mean, I would stay away from, if you're sweating for, hours a day, sure, you might want to be getting up towards like, 100 ounces, but that's not something you need to do if you're just sitting around not losing it for other reasons.
And we did have one of the docs talk on another talk about heat and hydration, about when you are sweating like that and you are putting more
Yes.
water in, so that you don't
Replace
go
it.
into hyponatremia. Maybe
Yes.
you need to add some of the electrolytes in, but that's
Correct.
not
Or
in
eat.
every time. Yeah. Or
Yes.
eat real food.
Mhm. Yeah.
Why is the cranberry supplement better than drinking an unsweetened cranberry juice?
Because you'd have to drink about 16 glasses of cranberry juice to equate the amount of proanthocyanins that are in cranberry supplements. They're very concentrated. And also that juice just has like sugar and other stuff you don't need that much of,
That's a great point. If a patient has heart failure and all the symptoms of CKD, and the patient has a high creatine BUN, when would the doctor look into a CKD?
Oh, like diagnosing it? Well,
Yes.
I think certainly like if they're worried about going on fluid restriction, if there are signs and symptoms of swelling, CKD is something that is diagnosed from a blood test, a basic metabolic panel, but you're not usually just going to get it once, you're going to get it a few measurements to kind of look at that. And so usually the primary care will do that if they're worried about the trends. And if they're really worried, then they'll send you to a nephrologist.
Okay. If I had a person who is experiencing frequent urination and they have type 2 diabetes and they are being treated for it,
Mhm.
how do you treat the urgency? You did talk
Yeah.
about, kind of thinking about it, but what else can we do?
Yeah, so diabetes really tends to affect the bladder in a bunch of different ways. And unfortunately, one of the ways, the most common way, is that it increases overactive bladder. It gives us more urgency, more frequency, more running for the bathroom in general. And that's a big, long pathway that I'm not going to get into, but that's the most common pattern that we see in patients with diabetes. And so there's a lot of patients, I see a lot of patients who, bladder retraining is not enough. And so we have options like medication, we have options like Botox, we have options to work on the nerve pathways locally to the bladder, not from the brain, to kind of help regulate overactive bladder once you get the diagnosis.
There's a lot of talk about sometimes that the UTIs cause some neurological or some like
Mhm.
dementia, not dementia, but dementia-like symptoms.
Yes. So as we age, unfortunately, the bladder doesn't give off as good of signs and symptoms that it's unhappy as it would normally. So it basically, if you're 15 years old and you get a UTI and it's an uncomplicated UTI, you're probably going to say, it burns when I urinate. I'm going way more often. It really hurts. I'm in pain. But unfortunately, we don't get those same simple signs and symptoms in some of our 90-year-old patients. And so what happens is that the body itself is affected and it's trying to give you the sign, hey, I'm in danger. Hey, something bad is happening here. Homeostasis is completely upset. And in those cases, that's when we start to see the neurologic deficits. Patients act goofy. Their water fluid balance goes off. That's another reason they can act goofy. So that's usually why we see it. We just don't get the warning signs as quickly or as well as we normally do.
What happens if someone only has one kidney? Is there any other precautions they need to take?
Yeah, I think that, there are patients that are born with one kidney or they're living with one kidney for various reasons. And those patients, if they get stones, like, extra special attention because you only have essentially one kidney. So if that kidney becomes compromised, well, that's all you have. So I do think that we, like to pay special attention to those patients. I know if I have a patient who has one kidney and has a history of stones, like we're checking regularly to make sure everything's okay, at least once or twice a year. Just because, that's all you have. So we don't want anything to happen to the good one, so to speak.
Now, kidney stones, what's the main thing that's causing those kidney stones to
Diet,
develop?
diet,
Diet.
diet, too
um,
much sodium.
Too much sodium. Now, what if a person is diluting their coffee, their juice, everything with water during the day? Does that count towards their water intake that you're looking
Yeah.
for?
Yeah, so I have I tell patients like if we're really trying to like, I have some patients who are like, listen, I hate water. I'm like, I get it. So nowadays, obviously, I don't love it, but we have all these things that you can add, like flavorings, stuff like that. So I'm glad that we have them and it helps. But I also think that, if you're someone who says, I'm chronically only drinking coffee during the day, well, if you're in a bad way and your water fluid balance is not good, then you need to like cup for cup. I drink a cup of coffee, I'm drinking a cup of water. That's going to make a bigger difference.
What if a person is having trouble emptying the bladder?
Good question. Lots of things going on and you need to see a urologist.
Very good. And that's
Yes.
sometimes what you have to tell them.
Yes.
Um, if you're dealing with a prostate issue, is it still a good idea to be drinking those 8+ glasses of water a day?
I mean, yeah, I wouldn't necessarily want to put myself into retaining urine. But again, probably needing to see a urologist in that case or working through things. But yeah, the 8 glasses is not so that, we produce so much urine. The 8 glasses is because our body needs it.
And 8 glasses isn't as hard as people think it is, especially because we're not trying to drink it all at one time. If you kind of set it
Correct.
out over the day, and some of the other things you drink do count towards it, but it's
Correct.
amazing. I challenge people to kind of measure it out for a couple of days just to kind of see what it is like. It doesn't mean you have to measure
Mhm.
it all the time. It
Yep.
gives you a feel of what it is, and I know that's a great. And look at you drinking your water now. Um,
Hmm.
if someone has a
32.
UT, it's very good. Yeah,
Mhm.
that's what I do. I have certain glasses that
Hmm.
I make sure I finish through. Is the best place to start if you're having a fair amount of UTIs is to go to your primary care, or when
Yes.
should they jump to see you?
I usually think, especially around here, I see so many of our Baycare docs, and they come in, or like the residents come, they're all fantastic, honestly, and they really are good with like knowing when to refer. So I really think seeing your primary care doctor first, and also not relying necessarily on trips to the urgent care, but really talking with your PCP about it.
Um, I don't know what this means. It says causes POP.
Pelvic organ prolapse,
Maybe, yes.
weak pelvic floor.
Okay. And I am looking to get a pelvic floor talk next year. For those of you who are interested, it is something that many people have asked about, and I think it is important. So we will be seeing that in 2026. Just making sure I had questions were coming into two spots. Is taking creatine over time affect the kidneys?
Okay, yeah, so I kind of really thought this was going to come up because it's like a hot button issue.
Yes, it is.
So I think at first when you know, the older evidence was saying that, like, you know, you can really affect kidney function, and creatine does. It upregulates your kidney function essentially, not on purpose, but it causes your kidneys to work harder. So you really need to really increase your fluids when you're taking that on a regular basis. I think most of the articles are now favoring that it's not necessarily a cause of, like, you know, kidney disease or anything of that sort, from what I've seen recently.
Okay. And we are running on time. So I have one more question for you here. Someone
Mhm.
asked about the strong foul smell that sometimes happens maybe for an extended period of time. What do we need to be looking for when we are having strong smelling urine?
So, infections, stones, there's honest to goodness a lot of medications and supplements that can cause that too. And
So, oh,
foods, certain
yes.
foods too.
I know, sometimes when you eat the cruciferous, like the Brussels sprouts
Hmm.
and the broccoli, that's going to help
Yeah.
with that. I am a migraine sufferer, so I do drink lots of water because I know if I don't, I have an issue. But some
Hmm.
of the supplements that my neurologist has me on causes there to be
Yep.
some funky colors and smells
And
coming out.
smells, yeah,
Yes.
and I see that even with over the counter supplements with that. So
Um, Going back to the dementia issue, the thoughts that come out where it's not really dementia, it's due to that UTI. We had another question about that. Someone has a doctor, they're seeing that, but what are some suggestions, maybe as children being caregivers to our parents or others around us? What should we be looking for, and where should we be sending them? And what should we be making sure that they're doing? I think that's a good way to end this.
I mean, I gotta tell you, one of the most common reasons that I see, I mean, it is very difficult when patients reach different ages, depending on where they're at in life, to get them to really improve their water intake. I mean, I've seen patients where I'm lucky if they've drank 2 cups of coffee today and that's it, and like half a glass of orange juice, and that's all they're getting all day. And so I think paying attention to things like that, and I know one of the reasons is because we're trying to not go to the bathroom and we're trying to not leak if that's a problem. But I really think regulating a lot of that fluid balance is an issue as we get older too. You know, our insensate losses change as far as sweating goes. So that's probably one of the biggest challenges, is just really making sure that the water, the fluid intake is better for those patients too.
Well, I want to thank you so much for sharing your expertise with us. It's always a pleasure to hear you speak because you have such a passion about this and you give us such information that's usable that we can
You're
take and
welcome.
do. And if nothing else, everyone needs to be drinking more water, and
Exactly.
finding ways to add more water into their day. We
Mhm.
have recorded this. I will send out the follow up, and I will send a PDF of the slides so that you can see all the pretty stuff. And we thank everyone for being here. And thank you, Dr. Szell. for
welcome. Thank
sharing
you.
your time with us.
Thank you for having me. Thank you.